Which of the following nursing roles are eligible for prescriptive rights? A. Nurse practitioner. B. Registered nurse. C. Critical care nurse. D. Charge nurse. The answer is A. Nurse practitioner. Of the nursing types listed, only nurse practitioners can be authorized to write prescriptions for pharmaceutical drugs. Communicating patient values, preferences and express needs to other members of healthcare team is an example of what quality and safety in the education of nurses. Competency? A. Patient-centered care. B. Evidence-based practice. C. Safety. D. Quality improvement. The answer is A. Patient-centered care. Communicating patient values, preferences and express needs to other members of healthcare team is an example of patient-centered care, which is defined as the act of recognizing the full agency of the patient by providing compassionate and coordinated care based on respect for patient preferences, values, and needs. Using tools such as algorithm flowcharts and cause-effect analyses to make processes of care more explicit is an example of what quality and safety in the education of nurses. Competency? A. Safety. B. Quality improvement. C. Evidence-based practice. D. Patient-centered care. The answer is B. Quality improvement. Using tools such as algorithm flowcharts and cause-effect analyses to make processes of care more explicit is an example of quality improvement, which is defined as the use of data to monitor the outcomes of treatment practices and other efforts to continuously improve the quality and safety of healthcare systems. Asking for help from a coworker or superior is an example of what quality and safety in the education of nurses. Competency? A. Informatics. B. Evidence-based practice. C. Safety. D. Teamwork and collaboration. The answer is D. Teamwork and collaboration. Asking for help from a coworker or superior is an example of teamwork and collaboration, which is defined as the ability to function effectively within nursing or integrated teams. Skills should include the ability to have open, mutually respectful communication, shared decision making, and a focus on patient care. Using a checklist for tasks when doing an in-home visit is an example of what quality and safety in the education of nurses. Competency? A. Evidence-based practice. B. Safety. C. Teamwork and collaboration. D. Informatics. The answer is B. Safety. Using a checklist for tasks when doing an in-home visit is an example of safety, which is defined as employment of practices that minimize the risk of harm to patients and providers both by individual performance and the use of systems, such as checklists, to avoid errors. A client calls the clinic and tells the nurse that her daughter has just been stung by a bee on the arm. She is worried that her daughter will have a severe reaction. What should the nurse do? A. Instruct the client to keep the arm elevated until swelling goes away. B. Tell the client to call back if the condition worsens. C. Ask the client if her daughter has ever been stung by a bee in the past. D. Advise the client to bring her daughter to the emergency room. The answer is B. Tell the client to call back if the condition worsens. The nurse does not have reason to suspect that the child will have an allergic reaction before symptoms are present. Thus, the patient should call back or come to the emergency room if symptoms present. The nurse cares for an immobilized patient on the surgical floor. Which of the following nursing considerations is essential for preventing ulcerations? A. Providing a well-balanced diet. B. Teach client the importance of coughing and deep breathing. C. Orient client frequently. D. Frequently turn and reposition patient while also providing skin care. E. Use compression stockings or TED hose. The answer is D. Frequently turn and reposition patient while also providing skin care. There are many possible complications from immobilization. Decubitus ulcers are one of these complications. It is essential to turn and reposition the patient at least every 2 hours while also maintaining skin integrity with skin care. Many other complications may result from immobilization and each have specific, related nursing considerations. Immobilization can result in desensitization and disorientation, so it is important to orient the client frequently. A well-balanced diet can promote better nutrition to prevent osteoporosis, negative nitrogen balances, and hypercalcemia from being bedbound. Compression stockings and TED hose are essential to prevent thrombus formation from stagnant blood flow in the lower extremities, which may lead to pulmonary emboli. Coughing and deep breathing is important to prevent the stasis of respiratory secretions, which could lead to hypostatic pneumonia. The nurse is caring for a 2-year-old child with chickenpox. While bathing the patient, the nurse's N95, surgical respirator, mask becomes saturated. The nurse should A. Exchange the mask for a new mask immediately. B. Dry the mask with the in-room hairdryer. C. Wait until the patient care is complete and replace the mask. D. Wipe with mask with a clean towel. E. Place a new mask over the old mask. The answer is A. Exchange the mask for a new mask immediately. Varicella, chickenpox, is a condition requiring airborne precautions. An N95 mask is considered ineffective when wet and needs to be replaced immediately. The nurse is preparing to enter a contact isolation room where she will perform a bed bath. It is reasonable to expect her gloves to become soiled at some point during the administration of care. While preparing to enter, the nurse A. Wears a single pair of clean gloves. B. Wears 2 pairs of clean gloves. C. Wears a pair of clean gloves under a pair of sterile gloves. D. Wears a single pair of sterile gloves. E. Wears 2 pairs of sterile gloves. The answer is A. Wears a single pair of clean gloves. In the interest of infection control, it is best to only wear 1 pair of gloves at a time. While giving a bed bath, it is not necessary to wear sterile gloves. If the gloves become saturated, remove the gloves, perform hand hygiene, and wear a new pair. International Normalized Ratio, INR, of 1.1. B. Alanine transaminase, ALT, 1200 to per L. C. Ringing in the ears. D. Higher blood pressure. E. Diarrhea and loose stools. The correct answer is B. Alanine transaminase, ALT, 1200 IU per liter. The nurse should be concerned about acetaminophen toxicity, as the recommended daily dose of acetaminophen is 4 grams for adults, and this patient has exceeded this amount. 3 500 mg tablets every 3 hours is equal to 12 grams in a 24-hour period. Acetaminophen toxicity may manifest with nausea and vomiting in the first 24 hours and right upper quadrant abdominal pain afterwards due to liver damage. Tinnitus, high blood pressure, and diarrhea are not symptoms of acetaminophen poisoning. An international normalized ratio, INR, of 1.1 is within normal limits, but may be trending upwards, as the liver is responsible for producing clotting factors. Liver function tests should always be done when acetaminophen poisoning is suspected. Aspartate transaminase, AST, and alanine transaminase, ALT, values above 1000 IU per liter suggest hepatic damage. The oncology nurse cares for a patient receiving morphine sulfate 2 mg IV push Q4H for pain. Which of the following most concerns the nurse? A. Respiratory rate 8 breaths per minute. B. Pain level 7 out of 10. C. Oxygen saturation 98%. D. Heart rate 65 beats per minute. E. Blood pressure. The answer is A. Respiratory rate 8 breaths per minute. The nurse should be aware of potential complications of morphine sulfate, which can cause respiratory depression. Therefore, a respiratory rate of 8 breaths per minute should most concern the nurse. The normal limits are 12-18. The heart rate, blood pressure, and oxygen saturation are within normal limits. A patient on morphine sulfate should complain of pain, and although a pain level of 7 out of 10 requires attention, the respiratory depression takes priority. The nurse cares for a patient receiving an intravenous transfusion of gentamicin through an IV catheter in the patient's left hand. Upon assessment, the nurse notices blanching and swelling at the site of the IV catheter, and the patient states he is feeling 8 out of 10 pain and it is burning. In what order should the nurse perform the following tasks? A. Stop the infusion, aspirate the remaining fluid, discontinue the catheter, and notify the primary care provider. B. Aspirate the remaining fluid, stop the infusion, discontinue the catheter, and notify the primary care provider. C. Notify the primary care provider, stop the infusion, aspirate the remaining fluid, and discontinue the. D. Stop the infusion, discontinue the catheter, notify the primary care provider, and aspirate the remaining fluid. E. Discontinue the catheter, aspirate the remaining fluid, stop the infusion, and notify the primary care provider. The answer is A. Stop the infusion, aspirate the remaining fluid, discontinue the catheter, and notify the primary care provider. The nurse must recognize these signs and symptoms as potential extravasation, where vesicant medication such as gentamicin, penicillin, Dilantin, or chemotherapy has been given. It is essential to first stop the infusion and remove the insult. The nurse must then aspirate the remaining medication in the catheter to reduce the amount of exposure to the vesicant. The nurse can then remove and discontinue the catheter and notify the primary care provider. The nurse counsels patients at a community health fair about the importance of immunizations. Which of the following statements is most accurate concerning immunizations? A. Immunizations provide natural immunity to some diseases. B. Immunizations will prevent all infectious diseases. C. Immunizations are risk-free and recommended by all healthcare providers. D. Immunizations give your body the antibodies to fight infections. E. Immunizations provide acquired immunity to some serious infectious diseases. The answer is E. Immunizations provide acquired immunity to some serious infectious diseases. The nurse should understand the mechanism of action, indications, and risks of immunizations as they do for all medications administered. Immunizations work by passively providing acquired immunity to specific diseases, such as influenza, hepatitis B, and varicella. They imitate the specific pathogen, influencing the patient's body to produce antibodies that are capable of defending the body if it is exposed to the disease-causing element. The nurse should know that immunizations are specifically made for some diseases, and do not work for all diseases. Immunizations also come with minimal risks, and although they are widely given, are not universally prescribed. Patients should be educated with potential risks. Some patients may experience fevers or rashes. Immunizations do not provide national immunity to diseases. Natural immunity is acquired by the patient when they contract a disease via exposure and the body produces its own antibodies. Immunizations do not provide antibodies to each disease. The community health nurse provides education about infectious diseases to college students in a dorm. Which of the following statements by the nurse would be appropriate? A. Hepatitis C is transmitted through ingestion of contaminated food and water. B. Hepatitis B is transmitted through ingestion of contaminated food and water. C. Hepatitis A is transmitted through ingestion of contaminated food and water. D. Hepatitis D is transmitted through ingestion of contaminated food and water. E. Hepatitis A is transmitted through infected blood and needles. The answer is C. Hepatitis A is transmitted through ingestion of contaminated food and water. Different types of viral hepatitis are transmitted through various routes. Hepatitis A is the only form that is transmitted through the fecal-oral route, contaminated food and water. Hepatitis B and D are transmitted through infected blood, needles as well as sex, and from infected mothers to newborns. Hepatitis C is transmitted through contaminated blood and needles. Recall that hepatitis D is an opportunistic infection, which requires hepatitis B infection. What is the most common type of thyroid cancer? A. Anaplastic carcinoma. B. Medullary carcinoma. C. Papillary carcinoma. D. Follicular carcinoma. The answer is C. Papillary carcinoma. Papillary carcinoma is the most common thyroid cancer, 60 to 70% of all thyroid cancers. Follicular carcinoma is the second most common thyroid cancer type, 10 to 20% of cases, followed by medullary thyroid cancer, 5%, then anaplastic carcinoma, under 5% of cases. Which thyroid cancer will present with a proliferation of parafollicular cells, C cells, that produce excess calcitonin? A. Papillary carcinoma. B. Anaplastic carcinoma. C. Follicular carcinoma. D. Medullary carcinoma. The answer is D. Medullary carcinoma. Medullary carcinoma of the thyroid originates from the parafollicular cells, C cells. Elevated levels of calcitonin in these patients cause diarrhea, which is the most common clinical symptom. Papillary carcinoma, follicular carcinoma, and anaplastic carcinoma are not associated with any significant elevation in calcitonin levels. What cancer presents with the following triad: hematuria, flank pain, and an abdominal mass? A. Mesothelioma. B. Ewing's sarcoma. C. Renal cell carcinoma. D. Hodgkin's lymphoma. The answer is C. Renal cell carcinoma. Hematuria, flank pain, and an abdominal mass are all signs of renal cell carcinoma, an adenocarcinoma originating in the proximal tubule of the kidney. Mesothelioma is a form of lung cancer associated with asbestos exposure. Ewing's sarcoma is a type of bone cancer common in children and adolescents, and Hodgkin's lymphoma is a cancer that originates in the lymphocytes of the blood. What is the most common type of liver cancer? A. Hepatoblastoma. B. Cholangiocarcinoma. C. Hepatocellular carcinoma. D. Teratoma. The answer is C. Hepatocellular carcinoma. Hepatocellular carcinoma accounts for approximately 75% of all primary liver cancers. Cholangiocarcinoma and hepatoblastoma are rare forms of liver cancer, and a teratoma is a tumor that contains normal-appearing tissues from multiple germ layers, which can appear in multiple locations in the body. All of the following cancers frequently metastasize to bone except A. Prostate cancer. B. Lung cancer. C. Breast cancer. D. Stomach cancer. The answer is D. Stomach cancer. Breast, lung, kidney, and prostate cancers make up approximately 80% of metastases to bone. Stomach cancer can metastasize to bone, but it does so only rarely. The appearance of red, purple, brown, or black papular lesions on the extremities, back, face, mouth, and genitalia is a typical presentation for what malignancy? A. Melanoma. B. Pancreatic cancer. C. Burkitt lymphoma. D. Kaposi sarcoma. The answer is D. Kaposi sarcoma. Kaposi sarcoma presents with red, purple, brown, or black papular lesions on the extremities, back, face, mouth, and genitalia. It is caused by human herpes virus 8, HHV8, and is typically seen in immunocompromised patients. Neither Burkitt lymphoma nor pancreatic cancer typically present with any associated skin lesions, while melanomas tend to be singular lesions. What type of cancer generally presents with elevated calcium, renal failure, anemia, and lytic bone lesions? A. Osteosarcoma. B. Gastric cancer. C. Multiple myeloma. D. Ovarian cancer. The answer is C. Multiple myeloma. Multiple myeloma, also known as plasma cell myeloma or Collar's disease, presents with lytic bone lesions, blood count abnormalities, elevated blood calcium, and an abnormal paraprotein antibodies which can cause damage to kidneys. Osteosarcoma, while located in the bone, tends to present with a mass visible on imaging. Gastric and ovarian cancer are not associated with any changes in bone, unless due to metastasis. What is the most common malignant brain tumor in children? A. Medulloblastoma. B. Meningioma. C. Juvenile pilocytic astrocytoma. D. Glioblastoma. The answer is A. Medulloblastoma. 90% of medulloblastomas are in pediatric patients. It is the tumor type in 14.5% of primary brain malignancies of childhood and adolescence. Glioblastoma is the most common type of brain tumor in adults and accounts for 52% of all primary brain tumors. Meningiomas are also fairly common in adult populations, accounting for 34% of primary brain tumors. Juvenile pilocytic astrocytoma is a brain tumor of childhood but only accounts for 2% of cases. Actinokeratosis occasionally develops into which skin cancer? A. Squamous cell carcinoma. B. Basal cell carcinoma. C. Melanoma. D. Merkel cell carcinoma. The answer is A. Squamous cell carcinoma. Actinokeratosis occasionally develops into squamous cell carcinoma and is generally removed prophylactically. Actinokeratosis is not associated with development of any of the other skin cancer types listed. Which of the following types of lung cancer is most linked to cigarette smoking? A. Mesothelioma. B. Adenocarcinoma. C. Bronchial carcinoids. D. Small cell carcinoma. The answer is D. Small cell carcinoma. Small cell carcinoma, also called oat cell cancer, makes up 15% of lung cancers and almost always presents in patients with a history of cigarette smoking. Adenocarcinoma is the most common type of lung cancer in patients who have never smoked. Mesothelioma is most commonly caused by asbestos exposure, while bronchial carcinoids are often of unknown etiology. What condition may look like eczema around the nipple but is actually a malignant skin change? A. Invasive lobular carcinoma. B. Medullary carcinoma. C. Invasive ductal carcinoma. D. Paget's disease of the breast. The answer is D. Paget's disease of the breast. Paget's disease of the breast will often present as itchy, scaling, cracked, red lesions around the nipple. The other conditions mentioned are all forms of breast cancer, but all of them originate in tissues deeper to the breast and will generally present without a visible rash, though some skin changes such as redness or dimpling may occur. Which of the following is a benign tumor? A. Osteosarcoma. B. Chondrosarcoma. C. Fibroma. D. Neuroblastoma. E. Adenocarcinoma. The answer is C. Fibroma. A fibroma is considered a benign fibrous tissue tumor. The other tumor types are all malignant. What is the most common soft tissue tumor in children? A. Rhabdomyosarcoma. B. Desmoid tumor. C. Neuroblastoma. D. Epithelioid sarcoma. The answer is A. Rhabdomyosarcoma. The most common soft tissue tumor in children is rhabdomyosarcoma. This generally presents on the face, neck, or extremities, with nearly 1/3 of cases presenting with orbital involvement. 90% of all cases of rhabdomyosarcoma are seen in children, most often seen in children under 10 years of age. Leiomyosarcoma, epithelioid sarcoma, and desmoid tumors are all relatively rare soft tissue tumors of childhood. The nursing student prepares a report on acute versus chronic leukemia. Which of the following assessments is correct? A. Acute leukemia has a gradual onset and often occurs among children and young adults. Chronic leukemia has a rapid onset and often occurs among those aged 25 to 60. B. Acute leukemia has a rapid onset and often occurs among those aged 25 to 60. Chronic leukemia has a gradual onset and often occurs among children and young adults. C. Acute leukemia has a rapid onset and often occurs among children and young adults. Chronic leukemia gradual onset and often occurs among those aged 25 to 60. D. A rapid onset and often occurs among children and young adults. E. None of these. The answer is C. Acute leukemia has a rapid onset and often occurs among children and young adults. Chronic leukemia has a gradual onset and often occurs among those aged 25 to 60. To answer this question, it is essential to 1. Identify the correct definition of acute conditions versus chronic conditions, and 2. Identify the age groups that experience acute leukemia versus chronic leukemia. Acute conditions such as acute leukemias have rapid onsets, while chronic conditions such as chronic leukemias have gradual onsets. Acute leukemias are more common among children and young adults, while chronic conditions are more common among adults aged 25 to 60. Which of the following types of kidney tumors occurs most frequently in children? A. Renal oncocytoma. B. Chromophorenal cell carcinoma. C. Wilms tumor. D. Metanophrecatinoma. The answer is C. Wilms tumor. Wilms tumor, also known as nephroblastoma, is a rare type of malignant tumor that occurs primarily in children. These tumors tend to be unilateral, and will present as an abdominal mass with abdominal pain or tenderness, nausea and vomiting, and fever. 20% of cases will also present with hematuria. With what co-infection is Burkitt lymphoma associated? A. Hepatitis B. B. Cytomegalovirus, CMV. C. Epstein-Barr virus, EBV. D. Herpes simplex. The answer is C. Epstein-Barr virus, EBV. EBV infection is common in Burkitt lymphoma. In malaria endemic areas, it is thought that the cancer is actually caused by chronic malarial infection, increasing a person's susceptibility to chronic EBV infection. The same is assumed about HIV co-infection with EBV in the United States. None of the other infections listed are associated with Burkitt lymphoma. A 55-year-old client presents to clinic for a small slowly enlarging papular skin lesion on the right aspect of his nose that has been present for less than 6 months. The nurse is aware that sun-exposed skin is susceptible to lesions that may become cancerous. The appearance of the lesion is consistent with a basal cell carcinoma. What is the best initial treatment for this type of lesion? A. Ultraviolet radiation. B. No treatment is warranted at this time, the lesion should be observed for signs of overt changes. C. Radiation and systemic chemotherapy. D. Excisional surgery with possible use of topical chemotherapy agents. E. Wide excision of tissue down to fascia. The answer is D. Excisional surgery with possible use of topical chemotherapy agents. The proper intervention for a lesion on the nose should include complete excision of the lesion to send for a biopsy to discover the extent and type of skin lesion. It may require additional treatment in the form of topical chemotherapy drugs or further surgery depending on the pathological findings. White excision to fascia may be reserved for more invasive skin cancers such as malignant melanoma after an initial biopsy has been performed. Lesions that have been present for longer than 6 months should be biopsied as a general rule, although some practitioners may biopsy sooner with increased suspicion of ominous-looking lesions. A nurse is caring for a client newly diagnosed with chronic lymphocytic leukemia, CLL. The nurse is aware that this type of malignancy is associated with certain factors and clinical manifestations. Which of these is not associated with CLL? A. The affected cells contain a distinctive genetic abnormality, known as the Philadelphia chromosome, used as a marker of the disease. B. Treatments mostly include combination therapy of various chemotherapy agents, as well as radiation and splenectomy. C. Some diagnostic findings include thrombocytopenia, with the presence of lymphocytes within the bone marrow. D. There is usually no symptoms seen in early disease, with later manifestations such as fatigue, and night sweats. E. CLL is the most common leukemia in adults, mostly affecting men between the ages of 50 to 70 years of age. The answer is A. The affected cells contain a distinctive genetic abnormality, known as the Philadelphia chromosome, used as a marker of the disease. The Philadelphia chromosome is associated with chronic myelogenous leukemia. A patient with a strong family history of cancer presents to your clinic with a new diagnosis of medullary thyroid cancer. You are concerned that the patient may have the familial cancer syndrome, MIN2A, multiple endocrine neoplasia, syndrome. Which of the following represents the malignancies encountered in MIN2A syndrome? A. Medullary thyroid cancer, pheochromocytoma, parathyroid adenoma. B. Medullary thyroid cancer, colorectal cancer, uterine cancer, gastric cancer. C. Medullary thyroid cancer, pheochromocytoma, mucosal adenoma. D. Medullary thyroid cancer, parathyroid adenoma, islet cell tumor of the pancreas. E. Medullary thyroid cancer, head and neck cancer, esophageal cancer, anal cancer. The answer is A. Medullary thyroid cancer, pheochromocytoma, parathyroid adenoma. These are the cancers most commonly associated with MIN2A, multiple endocrine neoplasia, syndrome, a familial cancer syndrome that predisposes to development of numerous cancers in patients generally at younger ages that would be expected. One should have an index of suspicion for such a familial cancer syndrome when evaluating a patient with a new cancer who has a family history of similar cancers that are known to be associated with familial cancer syndromes. Medullary thyroid cancer, pheochromocytoma, and mucosal adenomas are seen in patients with MIN2B syndrome, not MIN2A. Medullary thyroid cancer, parathyroid adenoma, and islet cell tumors of the pancreas are not seen together in a particular cancer syndrome. Parathyroid adenomas, islet cell tumors of the pancreas, and pituitary adenomas are seen in patients with MIN1 syndrome though. You are the nurse taking care of a 20-year-old patient who complains of palpitations, feelings of anxiety, headaches, and sweating for the last 2 months. You take the patient's vital signs, and find that they are tachycardic and hypertensive. Thyroid function tests and a urine drug screen are both within normal limits. 24-hour urine catecholamines and metanephrines are markedly elevated. Which of the following is the most likely diagnosis? A. Cocaine abuse. B. Amphetamine abuse. C. Generalized anxiety disorder. D. Pheochromocytoma. E. Panic attack. The answer is D. Pheochromocytoma. A pheochromocytoma is a rare neuroendocrine neoplasm that arises within the chromaffin cells of the adrenal medulla. Pheochromocytomas can secrete norepinephrine and norepinephrine, which can lead to symptoms of sympathetic activation. Patients with pheochromocytomas may experience palpitations, hypertension, headaches, fatigue, flushing, sweating, nausea, anxiety, and flank pain, among other symptoms. The workup for pheochromocytoma includes 24-hour urine catecholamines and metanephrines, as these would be elevated in a patient with a pheochromocytoma. For the patient in this vignette, he or she complains of a number of symptoms that are consistent with a pheochromocytoma, and the elevated 24-hour urine catecholamines and metanephrines has a high sensitivity and specificity for pheochromocytoma, so this is the most likely diagnosis. Panic attacks and generalized anxiety disorder may present with similar symptoms to a pheochromocytoma, but would not account for the elevated urine catecholamines and metanephrines. Amphetamine abuse and cocaine abuse may present with some similar symptoms to a pheochromocytoma, but would not account for the elevated urine catecholamines and metanephrines, and also would have appeared in the urine drug screen. The urine drug screen in this patient was within normal limits. What muscle pathology is often linked to small cell lung cancer? A. Duchenne muscular dystrophy. B. Lambert-Eaton syndrome. C. Rhabdomyosarcoma. D. Guillain-Barré syndrome. The answer is B. Lambert-Eaton syndrome. Approximately 60% of patients diagnosed with Lambert-Eaton syndrome have an underlying cancer, most often small cell lung cancer. Lambert-Eaton syndrome is an autoimmune disorder in which the release of neurotransmitter is not permitted due to antibodies against the presynaptic calcium channels. This results in muscle weakness in the limbs. The other conditions listed are not associated with any respiratory cancers. 60% of cases of stomach cancer in the United States are associated with what infection? A. Staphylococcus aureus. B. Salmonella enterica. C. Escherichia coli. D. Helicobacter pylori. The answer is D. Helicobacter pylori. Helicobacter pylori is present in the stomach of 60% of individuals with gastric cancer. Cancer in these cases may be caused by chronic inflammation at the site of infection, resulting in metaplasia. Staphylococcus aureus, Salmonella enterica, and Escherichia coli are all common causes of gastroenteritis but are not associated with malignancy. Which of the following is not a risk factor for renal cell carcinoma? A. Hypertension. B. Alcohol. C. Smoking. D. Obesity. The answer is B. Alcohol. Smoking, obesity, and high blood pressure are among the most common risk factors for development of renal cell carcinoma. Other risk factors include genetic susceptibility, diuretic use, and male gender. Alcohol consumption has not been associated with increased rates of renal cell cancer. Renal cell carcinoma can cause what paraneoplastic syndrome? A. Syndrome of inappropriate antidiuretic hormone secretion, SIADH. B. Polymyositis. C. Hypercalcemia. D. Lambert-Eaton myasthenic syndrome. The answer is C. Hypercalcemia. Renal cell carcinoma can cause hypercalcemia, due to secretion of PTHRP, parathyroid hormone-related protein. SIADH and Lambert-Eaton myasthenic syndrome are both associated with small cell lung cancer, while polymyositis is associated with non-Hodgkin lymphoma. What cell line is metaplastic in multiple myeloma? A. Neutrophils. B. Plasma cells, also known as memory B cells. C. Natural killer cells. D. T cells. The answer is B. Plasma cells, also known as memory B cells. Multiple myeloma is caused by metaplasia of plasma cells. No other white blood cell type is typically metaplastic, though abnormal plasma cell accumulation in bone marrow does interfere with the synthesis of all other blood cell types. Hepatocellular carcinoma is also associated with what toxin? A. Lead. B. Organophosphates. C. Aflatoxin. D. Asbestos. The answer is C. Aflatoxin. Hepatocellular carcinoma is associated with exposure to aflatoxin, from Aspergillus species, which can be found in many foods. Most commonly contaminated foods are corn, peanuts, and peanut butter, pistachios, Brazil nuts, chilies, black pepper, dried fruit, and figs. Asbestos is linked to mesothelioma, organophosphate exposure is linked to leukemia, and lead exposure has not been directly associated with any increase in malignancy, although current studies are pending further evidence. Susie is a 42-year-old female and has recently visited a genetic counselor after referral by her primary care physician. She has a family history of breast cancer on her father's side. She was found to not have the cancer-linked BRCA1 or 2 genetic mutations. The genetic counselor explained to her that A. She cannot develop breast cancer, but can develop ovarian or uterine cancer. B. She cannot develop uterine cancer, but can develop ovarian or breast cancer. C. She may still develop breast, ovarian, or uterine cancer. D. She may still develop breast cancer, but not ovarian or uterine cancer. E. She cannot develop breast, ovarian, or uterine cancer. The answer is C. She may still develop breast, ovarian, or uterine cancer. The incidence of cancer-linked genes can increase an individual's risk of developing cancer. However, their absence does not guarantee that the individual will not develop cancers of any kind. Alice is a 25-year-old female who is visiting her primary care physician for a routine physical. Which of the following may be conducted at the appointment? A. A rapid antigen detection test. B. A urine analysis. C. A vaginal ultrasound. D. A cervical cerclage. E. A Papa Nicolau test. The answer is E. A Papa Nicolau test. A Papa Nicolau test, Pap smear, may be performed routinely on adult women as a screening for cervical cancer. A rapid antigen detection test, rapid strep test, urine analysis, cervical cerclage, or vaginal ultrasound would not be part of routine screening. John is a 60-year-old man who has a first-degree relative recently diagnosed with cancer. He asks his nurse what he can do to prevent himself from developing cancer. Which of the following is incorrect? A. Eat a healthy diet. B. Drink 3 to 5 glasses of green tea with antioxidants daily. C. Wear sunscreen when exposed to the sun. D. Exercise at least for at least 150 minutes weekly. E. Rest for 6 to 8 hours nightly. The answer is B. Drink 3 to 5 glasses of green tea with antioxidants daily. Green tea has not been proven to decrease the risk of developing cancer. All other precautions have been shown to decrease the risk of developing various cancers. Your patient is experiencing diarrhea after receiving chemotherapy. Which of the following is an appropriate nursing intervention? A. Instruct the patient to take Nclex daily. B. Encourage the patient not to eat until the diarrhea passes. C. Instruct the patient to eat a diet high in soluble fiber. D. Advocate for the patient to eat a high residue diet. E. Encourage the patient to remain as sedentary as possible. The answer is C. Instruct the patient to eat a diet high in soluble fiber. A diet high in soluble fiber will help to decrease the effects of diarrhea. Note that soluble fiber also provides relief from constipation. Nclex is a stool softener that will cause increased diarrhea. Remaining sedentary and not eating are not necessary and will not help a patient recovering from chemotherapy. A patient is suffering from alopecia secondary to chemotherapy. Which of the following is the correct course of action for the nurse? A. Avoid discussing the topic with the patient. B. Suggest dyeing the hair a lighter color. C. Change the bed sheets and towels frequently. D. Shampoo and brush frequently to reduce fallout. E. Use heat tools and products to maximize hair volume. The answer is C. Change the bed sheets and towels frequently. Hair loss can be alarming if large amounts of hair are seen in linens. Shampooing, brushing, heat tools, and hair dyes can increase fallout. The nurse should welcome healthy discussion about self-esteem if appropriate. Which of the following would raise suspicion for thrombocytopenia? A. The patient's blood seems to clot abnormally fast in response to injury. B. The patient is excessively hungry. C. The patient appears to have a slightly pink tint in skin color. D. The patient is experiencing an increase in depressive symptoms. E. You see small bruises that appear under the skin. The answer is E. You see small bruises that appear under the skin. Thrombocytopenia occurs when the blood does not have a high enough platelet count. Slow clotting blood, increased bruising, or petechiae can all point to thrombocytopenia. Anemia, a side effect of many chemotherapeutic agents, involves which of the following? A. The blood does not have enough healthy red blood cells. B. The blood does not have enough platelets. C. The blood does not have enough antibodies. D. The blood does not have enough healthy white blood cells. E. The blood does not have enough plasma. The answer is A. The blood does not have enough healthy red blood cells. Anemia is a condition caused by the deficiency of healthy red blood cells in the bloodstream. This results in lack of sufficient oxygen delivery to tissues. Which of the following is a consequence of a carcinogen? A. Carcinogens increase the plasma membrane's permeability to insulin. B. Carcinogens permeate the Golgi apparatus. C. Carcinogens bind to the cell's plasma membrane. D. Carcinogens alter a cell's DNA sequence. E. Carcinogens detoxify protective lysosomes. The answer is D. Carcinogens alter a cell's DNA sequence. Carcinogens cause cancer by making changes to the host's DNA. They can be chemical, X. Pharmaceutical drugs, or viral, X. Epstein-Barr. Additionally, exposure to radiation has also been known to damage DNA and is another form of a carcinogen. Ethel is an 80-year-old woman who is receiving chemotherapy for the treatment of a tumor. You are the nurse taking care of Ethel, while her chemotherapy is infusing dash. A. You ask your colleague to cover you while you go to lunch. B. You practice hourly rounding. C. You elevate the extremity of venous access. D. You call the physician frequently to update him on her response. E. You check the infusion site frequently. The answer is E. You check the infusion site frequently. Chemotherapeutic agents are often very irritating to the tissue if they unintentionally travel to areas outside the vein. They can cause severe tissue loss and degradation. Patients receiving chemotherapy need to be monitored closely for signs of infiltration. Nathan received chemotherapy 24 hours ago. You instruct Nathan to dash. A. Flush the toilet twice after going to the bathroom. B. Wear gloves when preparing foods. C. Clean soiled areas 3 or more times using bleach. D. Throw away soiled sheets for 48 hours. E. Only drink bottled water for 48 hours. The answer is A. Flush the toilet twice after going to the bathroom. People receiving chemotherapy should flush the toilet twice after use for at least 48 hours to avoid exposing anybody else to the byproducts of the chemotherapy drugs. Wearing gloves when preparing foods, throwing away linens, using excessive bleach, and drinking bottled water are not necessary and do not significantly reduce risk to others.